The hygiene challenges of the Wild West. An in-depth examination. Welcome to the Wild West, an era characterized by legendary cowboys, intense battles on the frontier, and tales that evoke a sense of nostalgia for the rugged American spirit. However, let us clarify one point. If you believe the Wild West was a glamorous time, you are mistaken. Today we will explore one of the most unsanitary and unpleasant aspects of life on the frontier, hygiene. Picture this: dusty trails, perspiring cowboys, and rivers that were bathed in only once every few weeks, if they were fortunate, all while wearing the same clothes day after day. Indeed, the hygiene standards of the Old West were as chaotic as the gunfights themselves. In this episode, we will reveal the harsh truths of frontier existence to illustrate just how challenging life was. Brace yourself for some rather unpleasant details. Before we proceed, please remember to subscribe and activate the notification bell to stay informed about our latest content. Thank you for joining us. Let us begin with a universal truth of that time. Everything, without exception, had an unpleasant odor. Unlike the present day, where hot showers and soap are commonplace, the settlers of the Wild West had to endure life without easy access to these amenities. As for the smell, it was certainly unforgettable. Water was a scarce resource on the frontier, and the idea of wasting it on frequent bathing was almost absurd. Most settlements had limited access to water, which meant that clean water was primarily reserved for drinking and cooking rather than bathing. This resulted in a lifestyle where dirt, sweat, and grime were commonplace. Water sources were so limited that often a single body of water would be utilized for multiple purposes. The practices of drinking, washing, and waste disposal were intertwined in the Old West. As noted by Distinctly Montana, it was not unusual for upstream outhouses or cattle watering sources to contaminate the very water consumed by people. Consequently, access to clean, drinkable water became a rare privilege, resulting in the entire settlement often exuding a rustic odor. Envision gathering around a campfire amidst the scents of unbathed individuals, livestock, and outdoor latrines. This was the authentic fragrance of frontier life. What did bathing entail during this period? One might imagine a small, rusted tub, perhaps filled with water if fortunate, situated outdoors or within a communal bathhouse, if such a facility existed in the town. Typically, if a family possessed a tub, it would be filled weekly, with each member taking turns in the same bathwater. The cleanest individual would bathe first, while the dirtiest would settle for the murky remnants. Bathhouses began to emerge in larger towns, particularly during the gold rush, as affluent prospectors and miners sought a touch of luxury. However, for the average settler and cowboy, bathing was infrequent, with some going weeks or even months without a thorough wash, resulting in a common layer of dirt and sweat among all. Although they did not adhere to contemporary cleanliness standards, individuals of the frontier were certainly cognizant of odors. They employed various methods to enhance freshness, utilizing herbs such as sage and lavender to disguise unpleasant scents. Additionally, tobacco smoke was a favored means to mitigate odors, as it was believed to purify the surrounding air, albeit adding its own distinct fragrance. Now let us address the facilities, or rather the absence of adequate ones. Plumbing systems in the Wild West were virtually non-existent, resulting in rudimentary bathroom facilities. The most prevalent type was the simple outhouse, typically constructed as a small wooden structure situated at a considerable distance from residences and towns to minimize odor. Inside, one would generally encounter a basic wooden bench with an opening leading to a pit beneath. This pit would accumulate waste over time, and when it became excessively full, it was either manually excavated by an unfortunate individual assigned to that task, or the entire outhouse was relocated to a new pit. This experience starkly contrasts with the sanitary conditions we are accustomed to today. In urban settings, public outhouses could be utilized by dozens or even hundreds of individuals, rendering them hotspots for bacteria and disease proliferation. Moreover, one must consider the omnipresent flies, attracted to waste and further facilitating the spread of germs. If you have ever camped and utilized a pit toilet, envision that scenario devoid of modern upkeep, and you will grasp the bathroom practices of the Wild West. It is noteworthy that toilet paper was not commonly accessible until the late 1800s. Prior to its availability, individuals resorted to using whatever materials were at hand: corn cobs, leaves, grass, and even pages from the Sears catalog were far from the comfort of Charmin Ultra Soft. If you find this unsettling, brace yourself for the topic of dental hygiene. The absence of modern dental care rendered the Old West a veritable nightmare for oral health. Settlers indulged in sugar, which became increasingly accessible, enjoying it in pies and candies. However, this sweet treat wreaked havoc on their teeth, especially in the absence of regular brushing or flossing. Tooth decay, cavities, and gum disease were widespread, and the remedies were often as harsh as the afflictions themselves. With few professional dentists available, dental procedures typically fell to barbers or blacksmiths who lacked proper training. Anesthesia was often limited to a swig of whiskey, if one was fortunate. Toothaches frequently resulted in extractions which involved yanking teeth out with pliers or whatever tools were available. The pain was as excruciating as one might expect, leading many to end up with missing or broken teeth, contributing to the rugged appearance of the time. Some individuals resorted to makeshift brushing tools, such as twigs or animal hair, occasionally applying salt or baking soda as a rudimentary toothpaste. However, this practice was infrequent and far less effective than contemporary methods. Many people opted to forego brushing entirely, resulting in more bad breath and exacerbated dental issues. A significant hygiene-related concern on the frontier was the transmission of disease. The lack of sanitation in personal hygiene and communal areas meant that illnesses like cholera, typhoid, and dysentery were ever present. Reliance on contaminated water sources facilitated rapid disease spread, with entire towns being decimated by outbreaks. Consider cholera as an illustration. This lethal illness transmits through contaminated water, leading to severe dehydration and frequently resulting in death within hours. Due to inadequate sanitation, individuals residing on the frontier were especially susceptible to cholera outbreaks, particularly in mining camps where large populations lived in close proximity and depended on the same limited water sources. Even a minor infection could prove fatal in the absence of antibiotics or contemporary medical care. A simple cut could escalate to sepsis, and the limited understanding of germ theory meant that individuals did not fully grasp the reasons behind their illnesses. Instead, they often attributed their ailments to bad air or misfortune rather than poor hygiene. Another prevalent disease was typhoid fever, which was transmitted through contaminated food or water. Symptoms included fever, abdominal pain, and a rash. Frontier inhabitants lacked access to clean cooking facilities, making food preparation a common source of contamination. The issue extended beyond unsafe water. Any food prepared with it posed similar dangers. Cooking in the Wild West was not only inconvenient, but frequently perilously unsanitary. Meals were typically prepared over open flames or in makeshift kitchens where dirt, dust, and animal waste were omnipresent. Settlers often cooked in cramped cabins or open camps where maintaining sanitation was virtually impossible. Dust storms could cover everything in a layer of grime, and flies and other pests were a constant nuisance around food. Fresh water was a rare commodity, leading to dishes and cooking utensils being cleaned with reused or minimal water, if cleaned at all. In arid regions, settlers were compelled to use muddy or contaminated water from creeks shared with livestock and wildlife. Due to fuel shortages, this water was seldom boiled, allowing any bacteria or parasites present to enter their cooking pots. The storage of food presented a significant hygiene challenge. In the absence of refrigeration, meat deteriorates rapidly, particularly during the warm summer months. Settlers frequently resorted to drying or salting meat for preservation. However, even these methods left food vulnerable to infestations. Insects would deposit eggs in grains or flour, making the discovery of weevils or maggots in meals a distressing and common experience. The term protein surprise was not merely a joke, as pioneers often had to navigate around these pests or remove them prior to cooking. Furthermore, basic food preparation posed its own risks. Knives, pots, and pans were seldom sanitized due to the lack of cleaning agents. Leftover scraps and bones attracted rodents and insects, compounding the hygiene issues. Without proper waste disposal systems, settlers endured the persistent odor of decaying food in their vicinity. This environment heightened the risk of food poisoning and illnesses stemming from contaminated meals, leaving many settlers grappling with stomach ailments they could not fully comprehend. In the unforgiving conditions of the Wild West, cooking became not just a laborious task, but a continuous struggle against contamination and disease. While food was essential for survival, the unsanitary conditions rendered each meal a potential health threat, illustrating the harsh and unclean realities of frontier life. Now let us consider the topic of clothing. The process involved melting animal fat and combining it with lye, a highly caustic substance that could cause burns if mishandled. The outcome? Individuals frequently wore soiled, stained, and perspiration-soaked clothing, and with no deodorants available, the odor was quite potent. Picture a cowboy clad in heavy, sweat-drenched wool or leather after days on the trail, lacking showers or clean garments, merely layers of sweat and dust, an unforgettable scent. As for hair care, today we have conditioners, shampoos, hair masks, and salons readily accessible. However, during the Wild West era, hair care was quite primitive. Both men and women often sported long hair, but regular washing was a luxury few could afford, with most settlers washing their hair perhaps once every few weeks. Instead of shampoo, they relied on whatever was available, using soap if they could afford it, or natural alternatives like oils and animal fats to prevent excessive dryness. Hair often became tangled, greasy, and laden with dirt and dust, while lice posed a significant problem. With many individuals living in close quarters, lice could spread rapidly, leading to infestations that might persist for months without adequate treatment. In some cases, the only solution was to shave one's head or resort to crude treatments like kerosene, which were both hazardous and unpleasant. Regarding skin care, lotions and moisturizers were non-existent. The skin endured harsh sunlight, dry air, and extreme temperatures, resulting in chapping, sunburn, and premature aging. People used animal fat or oils as moisturizers, but these were not widely accessible and often came with unpleasant odors and a greasy feel. Individuals who toiled outdoors, such as cowboys and farm laborers, often suffered from sunburn, windburn, and calloused skin. The sun's harshness took a toll on their skin, and without the protection of sunscreen, it is easy to envision how their skin became tough and weathered over time. If you have ever found a mosquito buzzing irritating, consider the pest challenges faced in the Old West. The environment, rife with dirt, waste, and inadequate sanitation, was teeming with insects and rodents. Flies were a persistent annoyance, particularly near outhouses and food supplies. Mosquitoes flourished around stagnant water, transmitting diseases like malaria in certain regions. Bedbugs were prevalent in the inns and boarding houses frequented by travelers and locals alike, infesting mattresses, bedding, and walls, and biting individuals during their slumber. Fleas posed a significant problem as well, especially with the abundance of livestock. These pests infiltrated clothing and bedding, causing discomfort and incessant itching. With no access to pesticides or insect repellents, controlling these infestations proved challenging. In rural settings, rats and mice were a continual nuisance, particularly in food storage areas, where they spread disease and contaminated supplies, posing yet another health risk for those living on the frontier. Additionally, scorpions and snakes presented regular dangers to anyone sleeping outdoors or in inadequately constructed shelters. Pest management was typically reliant on natural remedies or the sheer resilience of the settlers. Life on the frontier posed significant challenges for women, particularly in terms of personal hygiene. The menstruation products we are familiar with today were unavailable, compelling women to devise alternative solutions. They frequently utilized rags or pieces of cloth as improvised pads, which required washing and reusing. This process was labor-intensive, and with limited access to water and soap, more sanitary options were not feasible. Pregnancy and childbirth also presented considerable risks. With hospitals being few and far between, many women gave birth at home, often assisted only by a midwife or a neighbor. The sanitation conditions during childbirth were inadequate, leading to a high incidence of infections. In the absence of modern antiseptics or antibiotics, even minor infections could prove fatal. Additionally, women's attire exacerbated the situation. The typical heavy dresses, petticoats, and corsets made the washing and drying of clothing particularly difficult. These garments were not only hot and restrictive, but also nearly impossible to keep clean in the frontier environment. It is understandable that women resorted to using herbs and smoke to conceal odors. The limited knowledge of germs and infections further complicated hygiene practices on the frontier. The field of medicine was still developing, and many settlers relied on folk remedies or possessed only rudimentary medical knowledge. Doctors were rare, and even when they were present, they often lacked the necessary tools and understanding to prevent infections. For treating wounds and injuries, settlers typically employed alcohol or herbs as antiseptics, though this was only marginally effective. Bloodletting was a prevalent practice, with some illnesses treated by the belief that releasing bad blood would eliminate the sickness. This often left patients weakened and did little to resolve the underlying issues. When surgery was required, it was performed without anesthesia, aside from alcohol or a biting stick, and the concept of sterilization was non-existent. Surgical instruments were reused without cleaning, contributing to the spread of infections. In cases such as gangrene, poor hygiene can swiftly escalate a minor injury into a potentially fatal condition. If they were present, frontier hospitals were typically rudimentary, characterized by dirt floors and inadequate sanitation. The mortality rates associated with surgical procedures were notably high, and infectious diseases were widespread. Interestingly, while European settlers faced challenges with hygiene, numerous Native American tribes employed significantly more effective cleanliness practices. Many tribes had established long-standing traditions of utilizing natural materials for bathing and hygiene, such as sand, and plant fibers for skin scrubbing. Sweat lodges were integral to their culture, serving as a means to purify both body and mind. These practices not only maintained their cleanliness, but were also intricately linked to their health and spiritual beliefs. In contrast to the settlers, Native Americans implemented more sustainable waste disposal and water management techniques, which often mitigated some of the sanitation problems that afflicted frontier settlements. They engaged in more frequent bathing and utilized herbal remedies to address minor injuries and prevent infections. This disparity underscores the extent to which European settlers needed to learn how to adapt to their natural surroundings in ways that would not result in unsanitary conditions and illness. It is important to dispel several misconceptions regarding hygiene on the frontier. Films and television often depict the Wild West as a dusty yet romanticized era, featuring cowboys and saloon women who appear cleaner and more refined than they actually were. In reality, they would have presented a much rougher appearance, with soiled faces, unwashed hair, and dirt-encrusted clothing. Cowboys were not the polished, heroic figures portrayed in media. After spending days or weeks on the trail, a cowboy's attire would be stiffened by sweat and dirt, while his hair and beard would be wild and unkempt. Similarly, saloon girls, often depicted as glamorous, faced the same hygiene challenges as their contemporaries, with limited access to clean water, bathing facilities, and fresh garments. The same applies to gunslingers and gamblers, who did not enter saloons looking pristine. Instead, they would likely be sweaty, dusty, and reeking of tobacco, alcohol, and horses. The reality of the Wild West was one of grit and grime, and its iconic figures were no exception. So, how poor was hygiene in the Wild West? By modern standards, it was quite deplorable. Maintaining hygiene was a persistent struggle, and life on the frontier was characterized by dirtiness, unpleasant odors, and frequent dangers stemming from inadequate sanitation and medical understanding. Diseases were widespread, and basic amenities such as bathing and clean clothing were rare luxuries, making each day a fight against the dirt and filth of frontier life. Nevertheless, the inhabitants of the Wild West persevered. In spite of the harsh conditions and unsanitary environments, they succeeded in establishing towns, families, and communities in a challenging and relentless landscape. Their determination and fortitude exemplify human resilience, even though the reality of their everyday existence was far from the glamorous portrayals seen in Hollywood films. Therefore, the next time you turn on a tap, use soap, or brush your teeth, take a moment to appreciate that you were not doing so on the frontier. Ultimately, the Wild West encompassed many attributes: courageous, daring, and adventurous. However, cleanliness was certainly not one of them. This reveals the stark reality of hygiene during that era, which is not quite the romanticized image we often envision. Thank you for watching. If you are interested in more historical narratives that uncover the less savory aspects, please remember to like and subscribe.